conversation I ever be having, especially in our part of the world, you know, where say BBA you fever be yes fever ni nyina ye ba akoma yen. Enti say ye typhoid, say ye day, say ye oh when you fever kokope malaria drew. There is an outbreak of a fever called Lassa Fever. Na ebia na wate about Lassa fever, but we name symptoms, no. On say bunny fever, the symptoms are similar in also malaria. Ebia wafa malaria drew, but it still hasn't gone. There is an outbreak and no nearby when it comes to public health. I am passionate about it because it's the way that we protect the whole nation. Ruth Allortey, a public health nurse, when it comes to Lassa fever, what is it? What are the symptoms? What causes it? And how are we going to protect ourselves? Ruth,
thank you very much.
Lovely to have you.
Nice having you too.
How does it feel to be a public nurse, first of all? Because you do the education, right?
Okay, so I'm a general nurse.
Okay.
But I have qualifications in public health.
All right.
Currently, I'm the unit head for health promotion in Kolebu Teaching Hospital.
Fantastic, fantastic. So you spread the news when an outbreak to say Lassa comes.
Yes, so we do a lot of risk communication. So we call that how you will let the populace know about how to prevent themselves from getting diseases of public health interest.
Okay.
Yes.
To say risk management when it comes to health.
Yes.
Okay, let's go to the outbreak of Lassa, which is why we hear in the lot with you. And it seemed to have happened. So you realized or you got the notification that a fever like this has broken out, if I'm to put it that way.
Okay, thank you very much. So we were all here in Ghana, and then February, somewhere around 24th, the Ghana Health Service brought out a circular that we've recorded 2 cases of Lassa fever in Ghana. But to let you know, it's actually not the first time Ghana is seeing this. We've had similar incidents in 2011. It happened around Ashanti region. So it's not so new to us, but we were able to do well to control it. So ask ourselves, what went wrong? Why are we here again? So the critical thing is prevention. How can we know what Lassa fever is about, and how do we prevent ourselves from getting it? That is the most important thing that we all have to know.
Now, talking about when there was an outbreak, was it still Lassa fever? So the same Lassa fever has been out before, and now it is back.
Yes.
So what we're trying to find out is what actually brought about the Lassa fever again. First of all, someone will ask, what is Lassa fever? Just like when COVID came, it's that thing of what is COVID, what is COVID? And we had to, understand, because I believe that before you begin to tackle something, you need to know what it is. So when we talk about Lassa fever, what is it?
Lassa fever is viral hemorrhagic fever. So we'll say viral because it's caused by a virus. And it is hemorrhagic also because we have bleeding tendencies associated with the fever. It's a zoonotic infection because we get it from rodents. So when we say something is zoonotic, something that we get from animals. So it's not something that is living with us as humans. We get it because it has moved from an animal into a human being. So that is how we'll describe Lassa. So we say it is a viral hemorrhagic infection. So it's a viral hemorrhagic illness.
If you say we get it from animals, Rebecca said, do I get it from my pet? Because I have dogs, I have a cat at home. And kwamba and sona yare from animals. And what animals are we talking about?
So in the case of Lassa, we are referring to rodents.
Okay.
So if you know what rodents are, all of us might have seen rats or mice. Growing up, those of us who lived in the village, we love the kusie.
Even here in Accra, we still see them.
We love the kusie, inquiring with the fufu. Yes. So it's the same rodents that we see. That's Lassa lives in them. Unfortunately, when it's in the rodents, you don't see it carrying the Lassa virus because for them, it's okay with them. So the Lassa infected rats or mice can be walking around your kitchen, your storeroom, and then it will walk around your articles like your saucepans, plates. Even sometimes they eat our bread.
It's true.
Yes. So you come down to the kitchen and you are so hungry, you don't even check. And sometimes you even see that something is wrong with the front part. You just cut a part of it and then you are eating it. That bread is probably a Lassa
as
infected.
Soon as you said the cuisine, I was like,
you know, can I go?
Yes, of course.
When you said it was, zoonotic, and then you talked about virus, and then you talk about rodents. I'm just a bit my confused kakra because nature say emuwa no to say kura.
Yes.
Nkura no omo carry virus na omo carry virus no nti no ewo mumu. Ti say nkura no enenam fie na bia ye nnuane a ye de asisi ho a ye mua so. Na bia omo abedi bia na so om de omano aka. Ana bibisa na opese wo kira na.
Nti no the Lassa virus no ewo ekura no ne urine na se ne jonso ana se ne janan.
Okay.
Enti se ejanan ya na jonso yi bi ekoka bibia yesusu ye de aduane ana se bi pomo nam bayere ho banche ho ebi o ha wato obi ato ne store mu ekura ya ebi Lassa yi wo ne jonso mi wa befa drink kra omo ne nam ho wa jonso kakra awo wakoto wanhohoro ho wo de akawa no eche se Lassa yakọ mu. So this is how we get Lassa.
Uka no na uka se abapen Lassa yare abapen na yewomua na yante ne nka biom na je se yetimi esi ya no na asan ababiem na ukan na akwakoye se ye nkure so de sebi o menkase ya ne omo na tenamum West African countries there. When you talk about the West African countries there, they are found. African rats, they are all over. And ye husana ye ni o pamo crosses that na wo mo enenam na o mo ba. It is a sia no kwan be na ye be fa so sen ye sia no nkane a e call ye. It is sen ye then ye be ye. Ye titim fiefie mu ne niama na de ne ye be ye.
Okay, me that say. Okay, ansa na ye be ka de ye be ya ansa na yetimi esia no ana ya prevent ye home from getting Lassa no. Me pese me chemu se ba ne se ekura yi ana se kusie yi a Lassa yi wo ne junso mu ana ne janan mu abefa weduane bi ho ana wafa onchensen ana nyoma onsa akoka na se bi o etimi asa akoka wa no na se ya ma o Lassa kusie nam bi a Lassa wo mu a ya nua ne yie na wadi se ba sa na ko mu a between 2 to 21 days no we be start show symptoms let's just say e be o say wenya fever so ho I to say wenya ohunam onante kakra wa bre honam ye obasa we friend general malaise sa nyome wo hu say ye malaria ikra ye nya obia wo ho benya malaria ye ne sa nti ya na sa nyome enhyeda embonipa hu sa say oh miti start say ye me ya ebia malaria wan so Lassa de wenya free say wonya general malaise fever ne extreme fatigue no afi wo besan ebe ya to say wuti pai o na afi wenya sore throat ne critical nti pai ne sore throat no another stage of the infection nti wonya sore throat na afi na ya to say de afi unhu de ye o sa symptoms is started pe na say why infectious say even wo ben minua ikra na say we start wuti pai o wenya infection with Lassa na wenya sore throat obetimi di amano.
Oh really?
Yes.
To me call off from
yes it sounds obi wo ho na say wenya yare ni bia ne moja ne jonso fluid bia wo nipa ne ho no ebetimi asane
carries the Lassa.
Yes ebetimi so asane through aerosol nti ehu hia say ye be kai covid de ye no ye she mask no na afi ye hohoro ye nsa se be ya sempo wonu bia nya bi na wakohwe no yesusu de obi yare a ye boa pa obi a pese o kire no do so obi yare a and so Lassa de ukono obi yare wo fie no was starting nya headache na wenya sore throat na ukona oben no na se won hye bibia wo nsa e fe ne glove ye be protector na se wo hwe ni wie wan wo horo nsa any seminar emu ho na betimi enya yare ni bi
enti no na eche se modern eche se yare na wo kana de na obi adron so say ukwa adwuma wo say you use public facilities.
Yes.
Men kind of maybe you use the public toilets, you use offices, and now if it should be kept clean.
Yes.
Because ebia will be or will be no. And also nam ne mojamu anyway munti odron so na we ya ubetimi anya ya utensils yin so ebi on ma efie bebre ma menka obi wo hwa ye no bebre no ofa chance na ode esija so onhurum onye ne hwe oyi beka se ode kosija so eja aka ne de ebe ye okay sa ne tia na
mpacho entisa so last idea so far as you get so be so chance ni mu ansa ode esija so enti ukoso mo no onsa akoka te bia eja bofro to re bi kra ko se bramin tobi wato nti no onsa akoka ye no Lassa infected urine no when huni weni no akoka onsa atare bofro to no akoshe wenum nti na chese ubetimi aba down with Lassa fever.
Are we going back to the days where we have to wear the nose mask?
It's very important say wo ben obi a say no we hu say nipa ne yare signs and symptoms so show no chere say and next day mini we suan betimi aye Lassa ese say wo bo nose mask
Ruth mami bisa just before baby what kind symptoms no are very similar to yare ye wo ye maimu deda malaria could come with a bit of flu and way enti no e die ben na ye nsus a particular symptom no de e ka ho pa e wo say me rush me ban say no we dey Lassa.
Nti no a very very important thing you have to note ne say your back history taken nipa na ba hospital ho no or say na nsaminya fever nya general malaise nso so na de menya headache asemi or sore throat na no nso me ko enwremu me chie kura ye koye kusie nkwan so nipa ne be show all these symptoms but the history of contact with a rat or mice is very very important. And I say, na my sister bi yare ye ka se wenya yare bi na Lassa nti wa ben obi so a wenya bi. So all this history will let us know say it's likely that dealing with Lassa. But all the symptoms no say yentimi nsi anu ntem a nipa no be start bleed from all over. Ti e no all orifices ni hwene mu ne to bebia to kro da bia na ni kra obehu say nipa ni bleed. Nti hospital no sa ahensudua na sensu so ye ba nipa ne ho no etimi ma ye hu say no we are likely to deal with Lassa na che say afa nipa ne sample na nsa na so se bebie anu aka say ampa we ye Lassa no se ye de collab ye de konuguchi na ya confirm ya ma ye say this is Lassa nti nipa show all these symptoms say no public health staff come in take sample na we ye de konuguchi ye de konuguchi between 24 to 48 hours no na fan say and na ye de kwa by ochena na yensa aka so mo ka say case na mo de by Lassa na che say e betimi aka say we are now dealing with Lassa ti anya ade a wo de wani be hu obi aka say nipa we e wo Lassa ese ye test na confirm with the history
and there's my patch oh me so you've spoken well about the symptoms and even well of some of the preventions no I woman no but yanko ye chikakra na ye misa me pese me bisa yi se obi ewo Lassa no so how many days and it turns infectious me pese me bisa say how many days na you know onipa no won say obi wo Lassa e bia we share obi wo Lassa ennei but enena e bia ye ne ti e bia untimi anyway but when do you actually find out that adiena are infectious?
Okay me that say mpacho nhwehwemu a kire ye say Lassa fever say ne wo share obi me fan say wo de won akoka ekura or ye possibly infected with Lassa and I say when hu obi a wakoshe obi a or Lassa fever between 2 to 21 days depending on which literature you are using so between 5 to 21 days obe start show symptoms. Until at least between 2 days, 3 days, 4th day, 5th day, dear. Now, me sure say symptoms be clear for us to know say it's likely you are dealing with Lassa.
In actual sense, near what can I say? Around this time while Lassa fever is on the breakout, say you need your bush you need be wo na so show signs of fever, na feed your headache beka ho, na feed your sore throat na was see a rational hospital.
Yes.
Okay.
You bet me aso ano is there a cure?
Yes, thankfully with Lassa we have cure. Okay. And now the way virus nitian and said you who COVID no. So this one we call it arenavirus. And no, it's enveloped inside the virus no shatter. Into no shatter no and said naked virus no de see na we join into shatter de answer no be run ataria obe na aha. Into no yen mom ye be yen nipa no ye betimi aboa ye ho se be ya ye betimi aso ano. Na kase ye be prevent here, what should we do? The say ye ne say ye be make sure say ye store ye duane ewo rodent proof containers mo. Eche say bibia ye tighter say bio ekura no kraba ho a na no enka ye duane a ye bedi.
Okay.
Afen so duane a ye bedi bia ye to market o ye different room where say ye washing ye salt solution. Ye make sure say ye kosho obi a ye djuma wo hospital say no we are very at risk because especially teaching hospitals, referral hospitals because obi yare sesi a no nya fever e bia nkwanchen clinic bi e ben obekọ ho na nso so emu ye den a omo de ne beba referral centers e bedu referral center na say we do serious stage. You say we can say infectious state into hospital for mo be kwa receive no mo a mo be try say mo save no mo man oxygen mo ye mo nyina betimi anya bi.
Okay.
And we can at risk population and healthcare workers are very 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 at high risk.
I see that the education started right from the hospital. Because say ya kra na ye ba ayaresa wono ye ba hospital kra ba be for whatever reason yare higher kra no, we should be very careful when we come to the hospital because ansa na be doctor no wotete nipa ni musa wonnim obi yare a wode nam nti no wotete nipa ni musa na wanhwe ni ye a wakwa kofa yare foforo kra ka nia wode ba e bi kra na de malaria ne nam e be wie chire no wakwa kofa ye Lassa Fever and so aba beka ho me de piece at least no we have seen in term na young education kakra I hope say nkomo ayedi ye be ya hwe I think say we should just go back to wearing the nose mask because obi nam ho na sabio obi ho no mo a ho oyare pa utimi hu se bibi anopa but wakasha no ho nti hu se oyare oti we ni ti pa ne pa but wa pini timu pa na odenam nti no I think so we should just go back to washing our hands properly and quite often nose mask na yen she unam nipa mu keep your hands to yourself obi o hwa oba ye na ye unconsciously me kan obi onam ufro stairs a onsanam rails ho sa something you call you use a public toilet and na bibia onhoro wonsa with soap you could didi enhoro yensa you didi wie momu a ya ohoro yensa and all those I think say ye pe nam your friend saying kusie
wapena me yem she
ma ya papa but e was ye jai e was ye je obi was yo kusie we de obe de o sese kusie no o bi a na wo ni bi ye fa kusie nkola abu wi ansa ne de abaye nkwan no audience ya ye nya no obi was yo we jaka no ye de mako wo na the things we say to kill ourselves ye de jaka no ye de jaka no de yare bia wo mu bia no efrimu ana ye de jaka no de yibia Lassa odienyo we used to do that when we had the bird flu and all of that ni edi ni ayare mi ametifie menkan na de abesa me mi so nyame no na di kusie otiase nkura no kura na ha me no nkura na wo fie no kura na ha me no because ebi ni wo fie kura bia obekọ obi fie ana obekọ some area bi na nkura ewo ho so omo ne nam ani o ka banche me yam ahye me fa me fufu ni agranti Ruth some of the foodstuffs that you were talking about, say marketing.
Yes.
And you know our markets. Ekurani market, you know. Ekurani market, Ekurani asori, they are always there. Inti normal na namusa. That comes to our monies, everything. You know, once a while something breaks out and then it limits your livelihood.
Yes, more. But Ruth, you say prevention is better than cure. Are there any I know say your baba shasia royensa, just like you're saying, and start wearing the mask as you know, often as possible. But then is there any boosters? Are there anything you bet me aka so yeah kwako what's is here to be because the is everywhere.
Lassa is endemic in most parts of West Africa. So, Nigeria, said malaria. Yes, but WHO tries some day vaccine beba. But as at now, no vaccine no. Enyambaye. Nti ehumbe here say ye day preventive measures no ebeye juma because that will be a sure way for you to be free from Lassa. You have to wash your hands very well, sanitize when you don't have access to running water. So making sure say ube use rodent-proof containers to store your food. Eduane bia obekwa akoto say we market o say fi efuomo. Make sure say wa wo ho ye and sana wedi. Afei so ebi wo ho obeka say kusie na ma o ye de esija so naturally with Lassa no ansa na obe prepare de no say obe so. Enti obe so mo no. Ansa na obedi aduane na wenya infection dada. That is why it's out to send me a me pekusie nam ni fufuo yi a say mejai esan say Lassa bagana. Enti no say ye nyina ye jai say be ya ye be free from Lassa. Na Lassa no said the make enti said ye nya ye hu covid na nipa bebre wu ye no. Ye can case fatality a say nipa be say 100 ye wo dem ha krapo ne ya hwe obi o wo Lassa. Wa fast stages mu we nya fever. We nya headache, we nya general malaise, we nya sore throat. Ebia yentimi ensi anu ntem was started bleeding from babia, which is the severe form. Na se wa ha. Na se yetimi protect ye ho a, ye nya Lassa. Nti 100 people ni be 80% of us betimi nya mild symptoms a se yetimi call hospital ntem a betimi aso ano. Nti 20% ne be 1% case fatality for Lassa fever 1%. Nti na che say ye betimi aye hu bibi nti ese mene wo said ye ate ene ye bomodin ase ye be hohoro ye nsa ye na ye jai kusie nam no se ye betimi a
for now
na afen so wo ye kan say jamwa e wo fie a e be boa e won said ye jamwa on be
they go after
the rats yes omo be chesi omo no mo ekum
no ko omo ase be ba ne ho
enti no there be e jamwa no getting rid of the rats na say na wo why free na face so yes I be use to trap e de ekum wom no wo use to trap na say wo de bibi sha won sa e dia wo ni glove ofie na unya rubber wo de yi because say we wu kra na so wo Lassa na wo koyi no na de won sa pan yi na wo betimi anya e say wa koku no nso so na wasenya Lassa virus nti say ye careful na face ye won kola ofie ye be say ye kun ekra ya ye dirate wom from baby ye wo say make sure say powder there na ye di kum ekra no ma ye nyusu sanse o de powder no koya akola and obe feel say milk powder bi na egu ho woni ho no o dane o ho ana watam de ahye nenum since say obe kun ekra no wa kokum nipa nti e ho hia pa so obe dirate ana so pese okum ekra ana kisi obe bia o wa e say o make sure say o hwe omo wa around babies wo ho a top powder there no obe to trap there no na so wusu so a so de bibi hye wonsa asana we yi no e de nato bollem yen fa ye bolla nko achirechire say ya enye car na ba be fa no e so make sure say bolla no we chire na face your storage rooms say kura no ya omo panuane ni adenti ya no mo hyehye ho say ben kitchen na e say e pe kwan a ye bi e betum say be ya ukoda na chances of them getting out and contaminating your utensils and food
spoons
will be limited.
Now, what is the health service? I can see, sir, this is a startup, the education ongoing, no? What is the plan, you know? Because I be in nature, say, Ebiana see at her, ye di hunkomui, but beden nasa and komui, we so ye, it's a form of medium, one washing in a ebenya, sa, you know, education information, no? But what is the plan? from Ghana Health Service to make sure, say, it's gone everywhere, and the prevention and you know, the education and information on it, you know, it's gone viral.
Thank you very much. In Ghana Health Service, with support from Ministry of Health and WHO and other international agencies, we've done a lot of outbreak investigation.
Okay.
So baby a case ni fi buy no. Ya koho akoshe de buy said yes by na omo tete ho ya a lot of education that area. Ya call markets, ya call agbobulushi, ya call educating queen mothers near their education na yeguso. And so nyame adom cases here started with 2 cases. And you call ya national globally known so kwa obetimi nya be say 100,000 to 300,000 cases, and out of that you can have 5,000 deaths. Yeah dey ba ye started with 2. And you could do 27. You nya 1 death. Not just say many would na ye betimi aboa. Not just say cases ye nya biom kra honey ye pesi yeko. So we want to get to 0 count. Say ye beka say Lassa any Ghana biom. Inti I think it's about time you and I continue with education. With what we've heard and
Very
also practice the preventive measures so that we can end the outbreak.
That is good. The Lassa fever, what you must know. Meme dia kakra mekato was oh yeah, it be diagro, especially. Meme dia when it comes to my health, I will be painty. I know I don't joke with my health at all. Obi be kana me dia kokan we na me dia masa. Also ye kusie mu na de kotu jaswa. Onfa wonsa nka kusie no ho ntu janim. Inti no onfa wonsa nka ho ntu janim ni inti no. Na eye adekro ede yare ne ba no ewo wonsa ho. Wawie no horo wonsa ewo wonsa ho. Ebia wo de wonsa akofa wanim. Oh, yesi tokro bi ewo ubodi bia no. Oh, se edru wesa na moja e free mu badia. Ene ebia de afa wanim, odi akofa wonsa ho ansa na akọ horo wonsa. Ti wo horo wonsa ni na no. Na eye virus usede no akoka another part of your body. Prevention is better than cure. Yes. You can never be too careful. Yeah. So just men ko and fan ko no dia men ko, you know, and then just save yourself from it. Yeah, but that yeah Ghana Education Service and yeah WHO Ghana Health Service and so as a pa, you know, for this education information our mode air mini wo mienu yati ushia wabusuafo wuhia wonamfo wuhia school colleagues ene e bia wonamfofuo mu ana we na wonso ka fa kire wom because air spread is in it will help you. If you tell your friend wadamfo so be ya hwe no ankofa ma meka until let us all help to spread that information about Lassa fever. Yen kire say Lassa fever is real. Aba yare bia enkura ene de ba yare bia kusie ene de ba yare bia wo mo nam wo fie na omo so wo niam mu nchensen wo nuane ho a wo betimi ayare wo yare a symptoms ni bi ne se wo benya fever malaria symptoms bi nkakra sore throat na afeti paye pa na wo ho ye wo basa yesa na antena se menkyere wo se cure wo ho ye de awrade ase yare bebreba na ye ni ho ayare sa na afi nipa na ye basa ka open na onim se owu kwan so but we die ho ba ne ntem se wo bedru hospital ne ntem udru hospital ntem a wo benya ayaresa na wa ankode a ne kura ne se moja ine betu afa baabia. We don't want to get that. We are happy to hear say omo so ano we are worried and we are sad about the death yenya no ye 2 cases no one case of one death no yapa, but you know at least you know we are making a headway into no we are grateful. Let us be very mindful of the Lassa fever. It will be a obetimi aka once and sorry na
okay tianta na me sorry meka say se wo ho na wo ni obite ana we hu obi a wa start show symptoms ya ye ken say ye fever, general malaise, ana say wa start nya headache, sore throat na ohwa ni pay the nensa akoka ekura ana say we dikusie nam ana wa nom nkwan bi a ohwa ye dikusie na ye ana say sebio oye adwuma wo hospital na wa hwe obi a ka say owo Lassa fever sa nsunsuan so say eba ne say bia nipa ne te be say New Legon na say SSA oba hospital a entwen ka say Auntie Ruth Becca say ye no fi kolebu nti ne megidi say SSA kolebu ne yekọ ayaresabie bia ben wo no bo moden na manipa no enko ho Lassa said the TN say wuhu nsunsuan so na start ye infectious na wo nipa bebre mu a say nipa obeben omo nyina betimi enya yare ni bi enti eba sa na ama contact tracing say be ya ye betimi aso ano na ye den kan say bia wa fa trotro ana wo be omo fa trotro ye ko hu omo nyina we he enti no be bia wo bia start show symptoms ya bo modern say yare sabia bia ben wo no obekọ nti wokọ sa na ye hwe ne ye confirm say Lassa na chese ya ma wedro ntem ne etimi aso ano with Lassa no supportive treatment very important ye can supportive treatment say bia otipa o ne ya ma wedro na chese kọ when ya sore throat ne ya ma wedro na chese kọ ye ma IV fluid ana edin so si wo so na chese when ya ahoden sa no na wetimi anya ahoden ntem edro nso so wo WHO approved medication Bavarian and also so wo but no I just a trained healthcare professional na betimi access o no hu say wo hia sa edro no and it's only given in severe forms Lassa etimi sa pregnant women na hu papa san say enkola no monyem no be say 85% betimi ewu na fe pregnant women so mo edu o third trimester say ensa kaka be 3 months na wa wo no so be 35% of them ebetimi ewu Lassa ewo mu se yakase eduro wo ho de na nso so be se 1% ebetimi ewu so nipa be se 100 nya bia 1% betimi ewu wa yare sabia na se nipa bebre enya Lassa be 35% 15% to 35% betimi ewu enti ni owo de ade a ye nyina ye mpe moma ye nyina ye mbo modern ye hohoro ye nsa ye hand washing with running water and soap we nya bia wo sanitizer unya so bibi mu a na odi aye wonsa obetimi so abomode akai de we COVID time no mask wearing very very important na afa ye ndidi ye na ye njai kusie nam na we asthmatic na untimi mfakat na ijra mu anto ofia bomode nsa obenya trap de ani bi na odi achi omo wo de chi no na se wu a emfa wonsa kwan enso ekura ne mu ana kusie no nkoto no ntwene make sure say wa fa rubber bi achichere wonsa ansa na watu atwene nyina ye bomode ne ye we mu no mu a ye betimi esi Lassa no ndamas
yeda se papa I mean even for us in the studio no this you know about Lassa no we are very very grateful you know we've learned a lot and we'll make sure say we'll protect ourselves and we'll prevent this thing from happening and you know na say we no wasamba na waba church mukakraka. Thank you so much. Okay, so Lassa Fever, what you must know, I hope that you have learned so much to prevent you know yourselves from contacting this disease. Okay.